Welcome to the Philanthropy Network COVID-19 Weekly Funder Briefing. I am Sydney Hargrove. At this time, please place your computers and phones on mute if you have not done so already. And remember, as always, this session is being recorded and will be made available on our website at www.philanthropynetwork.org. Purpose of the call each week is to share updates on philanthropic efforts and resources and what we're hearing and what you are hearing on the front lines regarding the effects of the COVID-19 pandemic in our region. Each week we have an agenda that will not only share updates on new funds and funds available for addressing the pandemic, but also an opportunity for information sharing and open share. During our open share portion of the agenda, please unmute yourself, state your name and organization, and then begin your statement. Today, we're going to try something slightly different in that after each speaker, we'll offer a very brief moment for question and answer. So please offer your questions in the chat box. We'll try to get to as many as possible before we have to move on to the next speaker. That is something that's slightly different this week. This week, we have with us Mari Porter from the Office of the Mayor, City of Philadelphia, who will share with us information on the resource requests and community needs report. Mari?
Hi, good morning, Sydney. Good morning, everyone. Thanks so much for having me. Really thanks for everything you're doing. I know many of you. When I went into philanthropy, they said to me, don't worry, there's no such thing as a philanthropic emergency. Turns out there is. And so I really just want to applaud so many of you who are just moving really, really fast and actually responding to this, nationwide global emergency, but it is also a philanthropic emergency. So just thanks for that. So what I'm going to run through today is the city has prepared, and hopefully people have it, and if not, I'm sure Shira and others can send it around. We've committed to do a bi-weekly report that really identifies, from our perspective, how we see it, how our people in the Emergency Operations Centre are really seeing the community-based needs coming out. And so we've organised it into various kind of focus areas. And so what I'll do today is I'll just kind of maybe pull out some of the key pain points and the key issues that we see from the city. And again, a lot of it's from an emergency management point of view. And what we've also done is pull out for you, I was a little reticent at first, but I think it's most helpful. In the document, it really specifies those nonprofits who the city is working with, largely through our Emergency Operations Centre or in some other capacity, so that you can see that these are the nonprofits. It's not exclusive at all, but that these are the ones that we just really want to elevate to philanthropy. So if that's okay, I'll just kind of walk through the bi-weekly report, and either offline or via chat, please let us know. This can fit any format, so we can change it and get it better or shorter or however is helpful, and there are many links in there. So if the first part of the report is really a summary for those, and I don't know if I should share it on my screen at all, Sydney, or just presume people have read it already. I'll just kind of go through. So the first part of the report really talks about the summary of kind of the key things that we're seeing. I'm not going to go through a lot of this because it's a lot of the public health data, which I know that you are all probably consuming regularly, but just to say that Philadelphia is now at 10,000 cases. And I think another thing that's highlighted in the summary piece is the city is working really hard with the state and the healthcare systems to start to try and better disaggregate the data, the testing data in particular, by race. It's not how a lot of the data is captured, but we really understand the importance and the issues surrounding that. So we are doing what we can to start to, and some creative approaches that I think our public health people are trying to work on to triangulate different forms of information to get better demographic data, especially around race on testing due to the disparities that are there. I'll just highlight for your spare time, the Mayor sent a letter to Nancy Pelosi and the PA delegation identifying what we would like to see in the CARES Act. So I think it's worth looking at that because I think a lot of the issues that are raised there are also relevant to nonprofits and philanthropy. We're pleased yesterday that a bill was passed in the House, but for the city, we're really looking for the next stimulus bill, which will fund, which we hope, let's say, will fund states and local governments. And I just want to flag for you that the budgets of states and local governments is dire because of the sharp drop in revenues. And so we'll be coming out May 1st with our budget and talking to other municipalities around the region and elsewhere. It's not good. And so I say that to say philanthropy will be called on more than you already are when you start to see the shortfalls, and we are going to have to withdraw from contracts with nonprofits and others, which is going to be fairly heartbreaking, but we have to balance our budget. So I just want to flag that for you all, that in some respects, because of the municipal and state budgets, it's going to get harder. I will also say with unemployment, and again, I probably can share this offline, but we're getting unemployment data from this. We've just got unemployment data from the state that's disaggregating by race, and the disparities are fairly significant as well in terms of who is applying for unemployment and who is employed. So I'll flick now quickly to food distribution. And hopefully you've seen a lot in the media, but just to say that the city, really went out early on feeding children through the school district and charter schools. And now we've really focused also on, meals to residents. And then just last week, we launched a senior program around meals. And again, I've created hyperlinks in the document so that you can see. I think the thing we want to flag for philanthropy is, the nonprofits are doing a phenomenal job, but the system is still, I would say, fragile might be a too strong a word, but we are seeing, issues with the delivery system, and a lot of it has to do as well with volunteers, and we need a workforce to make this work, and that is clearly challenging. And I think another thing for philanthropy to consider is certainly what we're starting to look at is, what does summer look like? If we have not able to have camps, or they're much reduced for young children, how do we feed children? How do we continue to feed seniors? How do we sustain this? And another issue around summer I want you to think about as well around seniors is around cooling centres. For example, in Philadelphia, our libraries are typically those centres. If we can't fully operate, we're going to have issues around heat, and how do our young people, children and youth, keep them safe as well as keep them fed. So we're going to be at this food distribution for quite some time. Even as we open up the economy, we can't fully open in the way that we would want to open it. In Philadelphia, a lot of our kids get fed at our rec centres through our rec camps. Thank you to everyone who's been helping to fund Step Up the Plate with the Broad Street Ministries Project Home and Prevention Point. That's been very, very helpful in Centre City and Kensington. I'll kind of keep moving on to homelessness. And I know a lot of you fund in that area already. I think one thing has been important but heartbreaking for the city, and probably many of you, if we've been advocating for some time to not have outdoor feeding. And unfortunately, we've had to return to outdoor feeding with the COVID-19 crisis. So we're starting to do feeding in Centre City and in Kensington outdoors. I think I'll keep moving on that one, but there is a lot I think that, again, around the shelters and what is needed and I know a lot of you fund in that and probably know more than I do. There's a lot more that we still need to do for our unsheltered populations. The next kind of summary area is public health and behavioural health. There's a lot in here which is really around testing. We had to close, unfortunately, Citizens Bank Park testing because of FEMA withdrawing their funding. But you'll see in the next 24 hours, if not more, if not less, the city will be opening up more testing sites, and they will be in a more equitable distribution of neighbourhoods than they have been to date. Our testing sites have relied on the healthcare system, and that has not always been located in communities of colour. But it will not meet the need of, we still will be short on testing, which is a nationwide problem. With behavioural health and public health, we have our health centres are still open and operating. And we also work closely with Frederick Qualified Health Care Centres. We have telehealth, both of behavioural health and public health, and the phone numbers are on the sheet. So again, we would encourage people to use those resources, especially behavioural health at this time. It's I know people are really struggling. Again, I won't go. PPE continues to be an issue nationwide, and it is the case for the city as well. Let me just go through. I'm conscious of time. I think the other thing that Dr. Farley would say here is, while we're all very much focused on serving the needs of the patients and people who may or have contracted COVID-19, there is a real issue around the rest of the healthcare system and making sure that we keep people healthy if they have these other pre-existing conditions. So I think, our public health system is also trying to make sure that people are getting access to primary health care as well, albeit a lot of it unfortunately have to be online. Immigrant communities, we actually added this section thanks to recommendations from Shira. Again, I think there's a lot that we acknowledge and recognise the vulnerability of immigrant communities, and I would say, and I'm sure many of you feel this, I think there is still a gap in funding around immigrant communities, and particularly for those who are undocumented. And I think it's incumbent on us to figure out as a community, especially for undocumented and those who aren't covered by the stimulus, how we can do, some form of cash transfer in some way, because that really is a key solution. We will do food and we will do other things, but I think as a community, it's really trying to think about our undocumented residents. And again, I know there are people on here like Annalisa and others who know more than I, but just to know that in the city we are thinking about that, as well as domestic workers. And Open Society just gave us a $1 million grant, and there's some other funders on here as well. And we're really trying to think about what kind of platform we could use to do some form of cash transfer. And I'll just say one last thing on cash transfer. I do think in these times, it is part of a resilient, I think, public sector, but also a local government and part of a resilient non-profit philanthropic sector, that we have to figure out some form of ways to get cash into people's hands, with a whole lot of caveats around that. But I think, our systems, I'll talk for the city, are not built for that. And I think it's something that we should look to innovate with, and that's an area for philanthropy. Again, what's in this document is our Office of Immigrant Affairs has pulled out as well those organisations who they have been working with, and that they see on the front lines who are in need of support. So I won't go through them, but that's available. And then early childhood education, again, thanks to all those who have funded there, and the William Penn Foundation, Barra and Vanguard, who've set up the specific fund. I'll just say the city is also providing funding for a small business program to 85 providers. We are very conscious, and we'll probably set up some form of task force under the Office of Children and Families around both the opening and then the maintenance of childcare centres that are currently open. And as they slowly come online, there are real health and safety risks that those providers are really worried about. But just to say, on the public side, the state and the city have worked very carefully and diligently together to make sure that our funding, our PHL pre-K, SOTA tax funding still goes to early childhood centres. We do not want to cut them off. And so we're removing a lot of rules where you have to have X amount of seats. We're just continuing our funding. The district, if Donna Frisbee-Greenwald's on, she can talk about that. I'll move over from that. And then the other thing I'll just say on workforce, I think we're all very much focused now on the relief, but I'll just kind of draw your attention to some programs which we're trying to do through Philadelphia Works to have people do a transitional jobs program and help with our food distribution. But I think there's some innovation there that philanthropy might want to think about, especially as we move from relief to recovery. And I'll end there because I think I've probably used up a lot of your time already. Thanks.
Fine. That's fine. So we have time for maybe one question in the chat box. If you have one question, please post it now. Otherwise, we'll move on to the next speaker.
Thanks.
Sure. Thank you. I see us sharing. Okay. All right. Well, thank you, Mari. Thank you so much.
Thanks for having me.
Absolutely. And as you said, the link is in the chat box to the information that she shared. Any feedback, please. She's willing to receive that.
Yep.
So,
be great.
Thank you so much.
Thank you all.
Next up, we want to talk about how the infrastructure, grassroots infrastructure that was built for the census is now being redeployed to support efforts related to COVID-19. We have with us Stephanie Reed from Philly Counts 2020, City of Philadelphia. Stephanie.
Hello, how's it going? You guys are getting lots of city input today. So I'm going to quickly give an update. I know we have a lot of people on the call who either funded work around the census or who are involved in work around the census. There have been a lot of changes, and I think it's important for people to be aware of them. I am going to just share some slides as I run through it, but I do really quickly just want to share one thing that came across yesterday that made my head explode and the Census Bureau has been approved by OMB to, starting late this week, send out an email and text survey that will collect information about unemployment and a series of other things around COVID. This will be going on at the same time that they are sending invitations to participate in the 2020 census. I'm just sharing this so that if you hear it, you know what's going on. I think this is going to be much more complicated in parts of the country where people are responding heavily to social media pushes to participate online. We're actually not finding that to work so well in Philadelphia, so we may not see a whole lot of interference, but I know that there are people on this call who are in the Philly burbs, and I think that it could have a pretty profound impact and create a lot of confusion in some of those areas. So important to know. So really quickly, I'm just going to try to share these. It's going to look really informal. But the Census Bureau last week announced that they're seeking statutory relief from Congress that would extend their operations for a full 3 months. The way that that would look is their self-response would now run through October 31st. Enumeration, which is when people are on the door, would be from August 11th to October 31st. And group quarters is then going to be July 1st to September 3rd. So that's when they count people who are living in group environments. So that could be people experiencing homelessness, students, which all of these things, I will just say almost all of the group quarters operation actually falls in a category of they don't really know yet how they're going to do it. They are planning to reopen all of their offices on June 1st with a full staff. Full staff meaning whomever they actually have on board. And what I was told is that even if they have to do 3 shifts, keeping their office open 24 hours a day so that they can keep physical distancing in their office space, this is their plan. If this is approved, it means that the final report will not go to the president until April 30th of 2021, and the redistricting counts will not go to the states until July 31st of 2021. There are a few states where this actually creates some issues for having the maps ready for elections, and the Census Bureau is trying to work individually with those states to have plans so they could get their apportionment or their redistricting counts to them in advance. I do want to stress that this has to be approved by Congress and signed by the president. So it's not a done deal. The way that we're thinking about this is we should still just focus on trying to get our work done by the end of August, just in case. I think that also this new timeline presents a whole new series of challenges where you will have enumerators out in communities at the exact same time as presidential campaigns. And all of this is assuming that people can be out there at all. We know that there's already heightened concern around opening your door for anyone at all. Then you tack on presidential campaigns, then you add in enumerators. It just feels like a really extreme barrier for people to participate, especially in neighborhoods like Philadelphia neighborhoods where we do have low access to internet. There's all kinds of complications, and people really do need enumerators to support that part, to support them participating. As I mentioned before, the operations that are still being discussed and not quite figured out yet is service-based enumeration. So those are organizations that serve people experiencing homelessness. The overnight count that looks like our point-in-time count that we do of people experiencing homelessness. And then there was always this plan for the mobile questionnaire assistants. So those were the people with the Census Bureau who would go around with their tablets and go to community events and help people complete the census. That's still being figured out, but my sense from my conversations is that they're probably going to scrap that altogether. They are saying that they are going to resume hiring in June. I think that this is a really important point for us. It is very possible that many of the people who originally applied for these jobs may no longer be interested for a variety of reasons. It is a really different scenario now. And there are likely people who would have never applied before, who all of a sudden find themselves in a position where this is a great opportunity. So I think that this is a place where we can really focus in May. And we have had conversations with Philadelphia Works about doing online recruitment sessions and trying to have someone from the Census Bureau on. So these are some things that we're thinking about doing with different community partners. I want to really quickly just mention the things that we're asking people to do, because we are having to do some pivoting, and we will be having a call with the grantees that received grants through the Action Fund at the end of this week to try to help refocus them. So the first thing is communications and advertising. We are in just such a different world. You know, when we originally laid out our plan around the census, the idea was that we would do most of our communication in person through community-based organizations who have relationships with people. And of course, that is still part of our plan, but for obvious reasons, it is very difficult to do right now. And we really have no idea, you know, the update from the CDC yesterday, we have no idea if or when we're going to be able to execute those parts of the plan. So we find ourselves in a position where we actually need advertising in a way that we really were not planning to lean on before. So we are hoping that some of the grantees will divert some of that funding into purchasing individual ads or helping us figure some of that out. In addition, we do have a lot of people phone banking. This is really where the COVID community response captain training comes in. I think that it is incredibly important right now that, especially government, if you are doing engagement, that you are doing trauma-informed engagement. And that means that if I work for the city of Philadelphia and I call someone and I ask them to complete the census, they don't care if I'm just calling about the census. I am with the city, and they have some really profound needs. I can tell you this because I've been making these calls with my team. This week we're calling Mantua. These calls are complex. You know, when we call someone who needs support finding diapers or finding food, if our first question is, have you completed the census? 9 times out of 10, they want to hang up on us. So we are really finding that we have a much better chance having a conversation with someone about the census if first we ask how they're doing and if we can help them access any resources. So that's where this COVID training has become so important and so key to being able to continue doing authentic census engagement, is that we are now able to help people access the resources they need and then encourage them to participate in the census and make the connection to census data being key to funding for the next 10 years and the funding that we need for recovery out of this situation. So we have really been trying to push as many people as possible into that training so they can use an expanded script. It's also, of course, open for anyone who wants to participate, even if they don't want a phone bank. But if people are using the expanded COVID script for phone banking, we are requiring them to complete the training. It's an hour, but you really need it so that you have a good understanding of the resources that are out there and how to connect people to those. Then the third thing is we are working on a floating action day. I do think from conversations I've had that there will be some point in the summer where we're able to have one day where we can get all the rest of our door hangers out. We still have about 100,000 door hangers. We do see anywhere from a 3 to 6 point increase in the neighborhoods where we did the door hangers. So we still think this is a really smart strategy. So we're asking our partners to be prepared to plug into that. And then finally, we are convening a group to talk about ways that they're incorporating census into the work they're already doing. So a great example of this is Liberty Resources, who they serve people with disabilities. They once a month deliver food. So we took them bags with information about the census, their Philly Counts bags that we had purchased to use for other things. And they're putting their food in those bags when they deliver the food. So just thinking about where are the points of intersection where we can still continue to add this in. So I think the next question is, what do we actually need and how do we continue to do this? As I mentioned, we have been making a lot of calls. We're getting close to 20,000 phone calls in the city now since we started working from home. And one of the things that keeps coming up, and I think this is an important thing to raise on this call, is all of the resources that are out there point people to websites. And if they don't point people to websites, if they have a phone number, we're hearing, we did a Spanish training yesterday around COVID. The people on the call, one of the women told a story that she and 3 other women on her block every morning, they gather on their porches and they all call the state's unemployment phone number. And they sit there together every morning trying to get through. And they do it for 2 hours every morning and they have yet to get through. And this is the reality for people in our communities who do not have access to internet in their home, who do not have like a good smartphone like this. I'm talking to people on the phone who are telling me, hold on, the page is trying to load on my phone. And I see Andrew on here from DLA. I was gonna actually reach out to you today. I really think this is something that we need to be thinking about, that in this time, call centers are overwhelmed, people cannot get through. And in Philadelphia, we have a really high number of people that cannot go to these websites and access these services. So I think both for the census and for COVID, this is incredibly important. And it's one of the things that we're starting to see as a pretty serious concern. So I think that's it for the updates for me. I tried to get through as quickly as possible. I might have gone over a little bit.
That's fine. Thank you so much. That's so helpful to hear the details about the information of what you're seeing on the ground and in communities. So, and that is a perfect lead in. But before we go on to the next piece, let's have one question of how we can register. Trying to read it. How people can register for the COVID phone bank 1 hour training.
I'm going to just type it right in here. You can go to our website and we have the trainings listed and you can just sign up for one that works for you.
Well, thank you so much. Next up, we have, there's a grant opportunity for digital navigators, perfect lead in from Stephanie in technology. And we have with us Andrew Buss from the Digital Literacy Alliance, the Mayor's Fund for Philadelphia. Andrew?
Yeah, hi everyone. Thanks for having me today. I told Kathy yesterday it was actually a perfect segue from Stephanie to me, because the last grant cycle we worked really closely with Stephanie on some census work, and I was just listening to her points and they're quite interesting. Maybe I'll come back around to those. But for those of you who don't know what we do, let me give you about a minute of quick context and history about the Digital Literacy Alliance. And then what I'll do is talk about our current opportunities that are closely related to the pandemic. So I'll call it the DLA, or the Alliance, going forward, just for brevity. So the Alliance came out of the last Comcast franchise negotiation agreement that the city made with Comcast. In it were several internet-related provisions. So as things sort of started moving away from cable and closer to the internet, we asked for some things from Comcast that were internet specific. One of them, if you're wondering, was the Internet Essentials program from Comcast. And the other was something that was very general at the time, but called the Digital Literacy Alliance. And Comcast seeded what was essentially a fund with $500,000 at the time. Since then, we've put together an organization to support the Alliance, and that is basically a really nice cross-institutional group of experts, or mostly experts in the space of digital equity, digital inclusion, digital literacy, topics like that. We started making grant opportunities, I think it was in 2017, and we did 2 annual grant opportunities first, and we left those very general, really, because we wanted to see what the needs were out there, knowing that, as Stephanie alluded to, really, probably around 25% of Philadelphians do not have access to the internet. The number gets a little strange when you factor in mobile devices, but it's still safe to say that somewhere in that ballpark do not have internet access. Our third grant cycle, which was actually last year, again, was working very closely with Stephanie, because we wanted to tie digital inclusion work to the Census 2020 work. So it was really thinking about how we could enable some organizations to think really creatively about digital equity while supporting their Census 2020 efforts. And these were largely, and generally who we fund, are smaller community organizations, grants usually up to $25,000. That takes me to the current day. And I'll say another point here. We were just about to launch our 4th grant opportunity, which was very immigrant focused, right before this pandemic happened. So we ended up pulling that back, at least temporarily. And we have a grant out there now, and we also have a grant coming probably next week. These are sort of emergency grants for the Alliance. The first grant is really more resident facing. And the idea is a digital navigator concept, where this role would be located in maybe 2 or 3 of the higher capacity community organizations. Would really be probably a telephone hotline, or you could reach them through text or something like that. So getting to the website challenges here. But it would essentially be someone who could walk people through the various internet connectivity options that they have out there, which are actually kind of confusing because a lot of the telecoms have come in with some different low income offers. There are also probably an opportunity to really help people think through finding the technology device that is right for them. You know, there are some refurbishers out there. There are new devices, of course, you can purchase. So helping people think through what they would need. And then I think the third piece is sort of light advising in a way on services, perhaps. So to Stephanie's point, well, maybe it is something about helping people fill out a census form, or perhaps it is something about getting the person to the right representative to deal with their health care online. So that's the digital navigator concept. Again, there'll probably be 2 to 3 of those awards, maybe somewhere in the ballpark of 25,000. And the goal of that is really to sustain it well beyond the pandemic, because this is something that is caught on a little bit at a national level as well, frankly, and we want to pilot it in Philadelphia. On the more organizational facing side of things, probably next week, or really as soon as we can get it together, we will be doing what we're calling an emergency technology fund. This is based largely on the results of the nonprofit survey that I think you all have seen probably. A lot of technology concerns cited in there, and based on our sort of quick conversations with some of these organizations, it's been pretty clear that a lot of these places are having a really hard time working remotely themselves, much less serving their clients remotely. So the goal is to do kind of small technology awards, and we will probably make at least this initial round just to our existing grantees. And it would be a very quick application process where they would essentially tell us how they would use these $5,000 to $10,000 to help themselves work remotely or start to serve their clients remotely. And I'll say about the first opportunity, which was the Digital Navigator, we have generally a fairly long process of review for these applications. That's changing, of course, to be very streamlined so we can get the money out the door as quickly as possible. So that's kind of where we are today. The only sales pitch I really have for you is I would love to partner with anyone who is interested, particularly on those two pieces. I think there's a big need out there for organizations. We can only fund so many organizations. And I'm sort of thinking as the technology fund grant, a little bit comparable to the COVID-19 grant, right? Which was more for general operating expenses, or really whatever you wanted to use it for as an organization. But this is really more geared toward technology and the challenges of working remotely. And I'll just end by saying, even in the city, when we had to suddenly work remotely, it was tremendously challenging. And there's this digital divide within city government as well that we saw. So certainly in the residents, it's a big challenge and will continue to be so for a while.
Great. Thank you so much. I'm going to move now toward our COVID-19 funds updates. I'm going to start with a new fund and then move on to the PHL COVID-19 fund. So starting off, we have the Women's Way Rapid Response General Operating Fund, and we have Diane Corman-Levy from Women's Way with us this morning. Diane?
Thank you, Sydney. Good morning, everyone. So we just launched the Rapid Response General Operating Fund on Monday, which was really pivoting our Immediate Response Action Fund, which we've been doing for the last 2 years, which originally was designed to address urgent and unanticipated needs, but with a specific focus. This is providing grants of up to $20,000 per year for general operating support. We realize that there's a need for this immediate need to deal with what's happening at this time, but we also want to give them money as they kind of rebuild and hopefully can recover to economic stability. So it is for up to 2 years for general operating support. We are giving priority will be given to organizations that are led by women of color, because historically they get the least amount of money from philanthropy, organizations that have budgets of less than $500,000, and that are primarily serving women who have been particularly hit hard by COVID-19, including domestic workers, women coming out of prison, formerly incarcerated, immigrants and undocumented women, and those experiencing partner violence. Within 24 hours, we have already received 10 applications and about 30 phone calls from organizations asking about it. We have raised $200,000. We expect to go through that probably within 2 weeks. Our goal is to raise another $200,000 within the next month. So we're really working with our network of individual donors. So a great need and a very, very fast response. So thank you.
Thank you. We have time for one question. If anyone has a question, please enter it into the chat box. Okay, not seeing one. We'll move on to the PHL COVID-19 Fund update. I think we have Kate Houston with us from the United Way, Greater Philadelphia, Southern New Jersey. Kate?
Hi, everyone. Thanks, Sydney. Good morning, everyone, and thanks for those helpful updates. I know we're all sort of ravenous for this information as everything seems to be evolving so quickly. And on that note, I've shared with you all some of the sources of information that we keep close at the PHL COVID Fund, and I just listed them out and wanted to share them with you all. In the event that you have capacity, we've found these types of groups to be really helpful to keeping us abreast. So our proposals come in at a particular time, and no matter how fast we move, conditions, environmental factors are changing for those organizations all the time. You know, a little bit of information from the city, for instance, that lets us know they have continued to fund foster care agencies. Maybe we saw a proposal from a foster care agency where they didn't know that that was going to still be true today. So having these partners outside guiding us all the time has been really helpful. One, of course, is the Civic Leadership Council for the PHL COVID Fund. That group has a combination of private sector, public sector, and nonprofit representatives. It's a really rich conversation every 2 weeks that sort of provides us with some strategic guidance, but also helps us identify gaps as they emerge. We have been really leaning on networks and associations of nonprofits. The child care networks, those calls, sometimes 600 agencies from around the state join those calls, just tuning in to hear where the pressure points are in that area. The city's been hosting some really helpful hunger relief calls with the food organizations, and that's been really helpful to us as well. The county specific and the focus area funds, all of you, I hope as we all sort of gel more our data with Philanthropy Network and CHIP, I think that'll even become more productive, but it's been really helpful to us to hear from those folks as well. Government partners as much as possible. We've been trying to set up briefing times to understand what's going on with government funding as it might impact our proposals. The city has just been an incredible partner, and thanks to Madi and Cynthia in particular for making that information available. I know I mentioned this last week, but just want to say again, you know, we thought small and nimble for our grants review committee. That was the way to go. We started with 10 folks. It's now well over 30 folks. That means a lot of folks who are even on this call who work for foundations and our grant makers themselves all over the region. That adds so much richness to our conversations and knowledge, diversity, and sort of awareness about geographic context. 211 data reports have been really helpful to us, kind of getting a point, understanding what 211 callers are asking for and how we're seeing the types of requests changing over time depending on what's going on in the external environment. That's been closer to the ground. It's data. I'm not hopping on the calls, although I think it probably could. But hearing from people on the ground as opposed to you know, proposals that are really coming from an organization with their individual organizational needs in mind. News reports, obviously, and then these calls have been immensely helpful. Thanks again to Sydney and Philanthropy Network team for putting them together. Just a really quick update on fundraising and grant making. To date, we've raised $14.5 million in pledges and gifts toward the fund, and no small part thanks to many of the people who are here on the call today. Over 30 members of Philanthropy Network have contributed $25,000 or more to the success of the fund. We're continuing to actively fundraise. Olivia, I believe, I'm sure she's on this call. Actually, I don't say she's definitely on the call. She's always here to answer questions if anybody would like to connect. Our online fundraising, as always, this really warms our heart. We've had over 3,500 neighbors and residents who contributed $25 or more, and that number is nearly $700,000 in those smaller gifts, which is just awesome. And then lastly, as always, we have our next round of grants coming out tomorrow, about $2.5 million to a really diverse slate of organizations. Thematically, as you might have noticed from past press releases, we have been sort of elevating a topic from that overall slate. This week's really focuses on seniors. I just, something came up yesterday. One of our partners who will be funded, announced in the grants tomorrow, elevated for us a sort of immense complexity of being a senior or a grandparent with custody of kids today, and sort of having the dual anxieties of both your own health and also the complexity of needing to keep your child connected to school at this time. That was just a really powerful realization that came out of a conversation yesterday. Lastly, I just wanted to extend the offer. United Way continues to send Common Good newsletter every 2 weeks. That reaches well over 20,000 nonprofit professionals across United Way's footprint, but probably a little bit beyond that as well. And I'll just put a link in the chat box in case folks want to use that. It's really simple to submit information, but as new funds come online, we'd like to make sure we distribute helpful webinars, funding opportunities to the nonprofit sector. Thanks.
Great. We have a question. Someone asked, how can we get 211 reports for each of our counties? Is that possible? You're on mute.
Is it all right if I send it to, okay, great. I'll send it to Philanthropy Network and we'll distribute that. Thank you.
And then is the PHL fund still accepting applications?
Not at this time. We are not at this time. I think there's still a possibility that we reopen it or shift to sort of proactive grant making and looking at particular projects that we want to invest in it. But at this time, the open application process has been closed.
And then two more quick questions. One is, does the grant making committee have a nonprofit representative? That's from Valerie.
Yeah, I believe it does. I also, many of the folks on the committee also have worked in the nonprofit sector. Just to be clear, we did distribute a survey to get a better handle on what everyone's professional backgrounds are. So when we have that available, maybe I could share that back with the group.
Great, thanks. And then the final one, Stephanie Lerner, I'm going to try to read the question, and if I somehow misspeak, please correct me, but it says, could a list of the connection calls in different areas and good sources be compiled somewhere? And I don't know if that was to Kate or just to the general group as a whole.
I'd be happy to just send the list over, Sydney, if that's helpful.
Okay, great. Excellent. Well, thank you so much, Kate. Thanks for joining us again and for your update. At this time, we'll pivot toward OpenShare for other COVID funds or anyone that would like to offer additional details or information.
Sydney,
If you're
this is
speaking,
Susan
please,
Sherman from the Independent.
Go ahead, Susan.
Go ahead. I just wanted to update everybody that we are currently at $1.1 million for the food fund, Step Up to the Plate, and we anticipate we'll be at 1.2 within the next few days. One of the interesting things about this fund is we have now 6 sites that are feeding people. We just added CMAC in South Philadelphia, which has a dire need for food, that whole population. And we wanted to serve them. The other thing that was really interesting is, I know people probably saw the article in the paper on Saturday about the program. It says Catering to the Needy was the title of it. But one of the nice things that just happened yesterday is Kevin Bacon sent out to all of his friends a tweet saying that he was supporting this Step Up to the Plate fund for his Philadelphia, and that he hoped they would join him. So we really thought that was kind of cool. We've got Bon Jovi and Kevin Bacon on board. That's it.
Great. Anyone else? If you're speaking, you're on mute. All right, so I want to offer a couple of announcements before we close our call today. One, thank you, Russ, for telling us about the article in the Inquirer this morning from Pano about the nonprofit sector in Pennsylvania, and I'm going to post that here. And there's also information, findings from the Philadelphia Artists and Arts Organization's COVID-19 Impact Survey. I think someone on the team will post that link for you as well. Or maybe I could do it here. Sorry. There we go. And then other than that, we obviously there's resources updated every week on our website. Please feel free to take a look at that as well. And we try to get if you have additional information you'd like to send to us, please forward that to us, to Amy Seaschultz, and we'll get that updated on the website as well. Any additional comments or announcements or sharing before we close for today? As I said, last call for comment. Well, I want to thank you all for, Vanessa, were you getting ready to say something?
I just wanted to quickly share, this actually just came through my email box this morning, that the Chester County Department of Community Development has opened up a request for proposal for public services related to COVID-19. And it looks like it's going to open April 22nd through until May 21st. And they're specifically focusing on priorities include housing assistance and related services such as shelter, rental assistance, supportive services, childcare services. So I just wanted to sort of put that on your radar that, again, here's another relief, not a relief fund, but a call for proposal that's coming out of Chester County.
Absolutely. Thank you so much. Anyone else? Well, I always like to give the gift of time back to those when we have an opportunity to do so. So you have almost a little over 10 minutes back to your day. Please be safe. We look forward to seeing you all again next week with additional updates related to COVID-19 in Greater Philadelphia. Thank you all.
Thank you, Sydney. Thanks, everyone.